Much, Diane and Tamara. So anybody got any questions for either of them on the policy recommendations and findings of the focus groups? No, well, again, all of the work that they put into their presentations you will get on the Scirocco website. So thank you very much, ladies. So I think we're now moving into our final session for the day. Monsieur Marc Lange from EHTEL, who is going to just lead us through what happens next, what is going to happen beyond the Scirocco self-assessment tool.
Thank you, Donna. Happy to be with you and happy to see that you are still with us after these very busy days. I could tell you that's all, folks, as we said in cartoons. I could also tell you, and now they got married and had a lot of children, and the story is finished. No, it is not what I can tell you. I'm not authorized to say that. And I'm not authorized to say that for the simple reason that we now need to start working on next steps, as you announced it. Is this the slides? Yeah, okay. Yeah, so let's start first, step by step. What do we have in hand that we can continue to use beyond November 2019, if you did not capture it yet, by the 30th of, there is no 31st in November, so by the 30th of November, the project is finished. So what's next? So what do we have in hand? A concept of a maturity model, and the concept is also materialized in a document and also materialized with a number of, with a narrative, with a questionnaire, and all these sort of things. So that's a paper document. That's one element. What do we also have? The online tool. You have heard about it so many times today. I will not spend much time, but the online tool with associated methodologies, and that's absolutely an essential element as we have learned today. What do we have too? We have also quite some experience from the regions that demonstrate that this tool works. And we have also a set of recommendations, policy recommendations that will help to promote or to make the tool visible and to push in direction of supporting integrated care. And we have the maturity model and the online tool validated, tick. We also have, you have seen, we also have a name, a brand, and also a number of organizations who have been using the tool already and who are interested in using the tool. So all these elements are the outcome of the project and will be the basis for the next steps. And what are these next steps? Well, first of all, the very question is, what will we do with these tools? First of all, the objective is certainly to continue leaving the tool up and running so that it can be used. And it can be used because a number of regions have already identified and already made clear in the Scirocco domain and others that they want to continue to use the tool years after years in order to assess the progress. They also want to continue to use the tool for other practices. They have learned how to do it. They know how to create it. So why to stop with the good practices that they have been using today? But of course, as soon as you think about next step and you think about continuing maintaining the tool, a number of questions comes in, very operational question, basic question, but we need to address them. And what are they? First of all, we want to ensure some availability of the tool so that we know that when we're really organizing a workshop, we will have the tool available for the consensual bidding process. It will be available before that for people answering the questionnaire and all these sort of things. So we need to ensure there is some availability so that we can really create a process. We also need to be sure that the data and the personal data and the evaluation data that are in the tool are safely recorded and are not available to anyone who wants to have them. So these are simple parameters, but we need to ensure that these elements are in place in order to continue maintaining the tool. So that's a first level of ambition on what to do with these results. A second level of ambition that we can have, and I can tell you that we have, is to go beyond that. So extending the level of the services, providing some support to organizations to use the tool, to making the tool, of course, more and more known, distributing the information and enrolling other regions, other organizations to use the tool. That's really an ambition that we have. We also have the ambition to continue the training and coaching process and to integrate the tool and the method in further training and coaching process so that others can benefit from this experience. And last but not least, we start to have the idea that this process with this questionnaire may also be applicable in other domains than integrated care. And then we need to explore it. We need to explore what are the consequences of that. Probably we'll have to review the different questions that are being and the scales, the evaluation, the assessment scale. But so we will have to work on that. So all these elements are questions that we are asking ourselves or are part of the ambition that we would like to implement. Now, having ambition is fantastic. To go ahead is fantastic, but we need to remind a few basic principles, at least one. First of all, that tool has been developed for the sake of serving common good. That has to remain like this. So the tool has not been developed for commercial use. But having said that, it doesn't mean that everything is free. We know that exploiting, we know that maintaining the service operational, exploiting it, expanding it will cost. And we need to find mechanism and revenue to be able to at least to compensate the cost, if not to make revenue. So how to organize these elements and how to go step by step into the reality of an exploitation plan. We have been using this quite well-known business modeling technique that in one map ask a number of questions that we need to address to ensure that we are dealing with all the different parameters that needs to be covered, and we have filled it in. It's of course a very crowded slide, and I will, if you have an interest, I will encourage you to go through the slide offline. But let's first go through it. When you see in yellow, this means that this is really what is needed to be taken care of for simply freezing the tool as it is today, for continuing to serve all those who want to use it with today's feature and with today's version, what we will call the November 2018 version of the tool. That's the yellow part. And the blue part is what we need in addition to that in order to serve more ambitious plan. We, of course, are clear on what the tool is doing. We have been brainwashed with what the tool can do today. So that's clear. I will not cover that. We have also a clear understanding today on who are the deciders, who are those who will decide to create the workshop, to organize the workshop, to organize it and to apply it to some cases. So we know them. That's already clear. So we already have the service, the value, the added value of the tool, and we have already the customer. Let's use the term customer, irrespective of the fact that they have to pay or not. That's another question. But we also need to pay attention to some other parameters. First of all, and I mentioned it, and I just underlined it very briefly, if we deliver a service, we need to ensure that our customers trust the service. And that's about the service level agreement, and about the condition that I mentioned. Trust is an important element. Also, another important element, and that's about the kind of relationship that we want to put in place. We are in a working environment. We want to create a working relationship with the users of the tools in order to help them, in order to get the feedback from them, and in order to create a kind of self-learning mechanism in place. And we want to create, by doing so, we need to create a user community, a vivid user community that will be around the tool and that will benefit from learning from others and all these sort of things. So you see, we have a number of questions to address. Of course, we will need a managing infrastructure. Of course, we will need to create and to package a set of services that what we call here a knowledge hub that will provide the support that is needed in order to run the service. And of course, last but not least, all this is attached to cost. And maybe can I hide? No, I'm not a Mac user, so okay. Meaning here we need of course an operational budget for serving, and we also need an investment budget if we want to exploit the service. And in terms of revenue, we may consider revenue like fee per use, or like a yearly fee for the users. And of course, we will need EU, or not necessarily EU, project money in order to exploit it. And that's where the first part of the answer comes in. What's next? What's next is called Scirocco Exchange. We are absolutely delighted, and here I should refer to Andrea and Donna, delighted to have been able to submit a proposal, a proposal for an extension of the project, of a new project, and to win it. So, meaning that from the grant agreement is still under discussion. This is not yet settled, but we can be optimistic on this. So, this project will take care of this investment money that we are looking for to cover the cost of not only exploiting, but of maintaining the service up and running for all those regions and users who want to continue to use it. So that's one. So Scirocco Exchange will maintain the version of November 2018 of the Scirocco tool, and Scirocco Exchange will create a knowledge center, will support twinning and coaching activities, and will provide a number of services, including pushing or helping users to develop their own improvement plans or action plans. And Scirocco Exchange will furthermore explore the possibilities to expand the scope of the tool to other domains, other transformational domain related to health and care. But Scirocco Exchange is again a project, and that's here how I will close with another question, subject to further research or to further work. Scirocco Exchange will have to now make plan for how to go further beyond 2120. So that the service is sustainable, so that regions and organizations across Europe active in integrated care in other domains are still able to continue using the tool. And that's where I will leave you and leave Donna closing the session. Thank you.
Thank you, Marc.